Hey, welcome to Podsongs. Today I'm speaking with a retired American doctor who has written many books, and was a pioneer in the field of developing the relationship between the patient and the patient being involved in the healing process. He was really ahead of his time. He's 88 years old now. So it's a bit like speaking to my grandfather. I think I speak about 2 or 3 times in the whole interview. But he's a lovely guy. And yeah, it's the kind of doctor you would dream of having. So let me introduce you to Dr. Bernie Siegel. Hello, Bernie.
Hello, good morning.
You're looking very good today.
Thank you. I've trained you.
I got the brief. I listened to you on some other shows, and I know that's the way to do it.
It really makes a difference when you go places, because people, when you go into a store, everybody says, "How are you doing today?" And I say, "Don't upset me." And all the customers stare at you. And then when an old-time employee came in from the back of the store and said, "Oh, you're looking so well today," everybody burst out laughing. And then they got the idea, what a good feeling you get when you hear those words. So I really talk to people about it, because they're not really interested in how are you. And I know we're all wounded. That's another thing. What I tell people to do, put a bandage on and go to work or go shopping. One lady in the supermarket poked me in the back and said, "You are the only person who hasn't asked me what happened." She had a bandage over her eye. Mm-hmm. Now, again, my sense of humor, I said to her, "It's because I know what happened. I have an abusive spouse also." And then she didn't know about talking to me anymore. But that impressed me. Everybody is talking to her because she has a visible wound, and they know they can have a therapy session talking to somebody like that. So I say, don't hide your wounds, and then people will share and you get therapy out of it.
Wow, it's a great way to start. Well, let me just kick off here I'd like to read a fake biography of you. Bernie was born in Brooklyn in New York. He attended Colgate University and Cornell University. He had surgical training in Yale, New Haven Hospital, and at the Children's Hospital of Pittsburgh. He helped many patients throughout his career, working as a surgeon. He had many ideas to change the way healthcare was carried out, but the medical industry is very resistant to change. So he just got on quietly with the job like so many other doctors. He also wanted to write a book, but never found the time, working such long shifts at the hospital, not to mention raising 5 children. Finally retired from practice as an assistant clinical professor of surgery at Yale. And now he's living quietly in retirement, watching Netflix and taking his dog for a walk. So why is that not true, Bernie? We wouldn't be having this conversation if you were just a doctor. You're much more than that. Yeah. What's the secret?
The secret is, why are we who we are?
Okay.
Why do you become a doctor? I mean, think about this. You say, "I want to be a doctor," and then you choose to be an anesthesiologist. You're putting people to sleep all day long. I mean, what kind of relationship is that? I'm not saying there aren't some wonderful anesthesiologists who know how to relate to people before they take them in the operating room. But there are others who are just seeing them as something I pump drugs into. And so the suicide rate in that type of physician is higher than the general population.
Wow.
So I looked at why I became a doctor, and I may add, it was very painful for me to be a surgeon because I wanted to help people. I mean, my list was, I like people, I like fixing things, and I like using my hands because I was an artist as a child. Mm-hmm. If I had known you could earn a living painting pictures and selling them, I never would have become a surgeon, because it would have taken care of all the things I love doing. But anyway, so I become a surgeon, but I realized you can't fix everything. And what changed my life literally was one of my patients. I went to a conference and ended up being the only doctor out of 150 people. I couldn't believe that no other doctor came to this conference run by a physician on how to help cancer patients. And my patients were there and they sat all around me. They weren't separated from me in any way. And these were the exact words that altered my life. You're a nice guy. I feel better when I'm in the office with you, but I can't take you home with me. So I need to know how to live between office visits.
And you wrote a book about that.
Yeah, we all need to know how to live. Everybody's writing books. It never stops. You know, if you look at the list of books that get written all the time, it's, again, how to live, how to live, how to live, how to deal with troubles. And what I did was start a support group to help the patients live. And they became my teachers. Because then you do realize that there's a survivor personality. See, psychiatrists know more about these things than the oncologist or the surgeon, because they're taking care of the person and their emotions. The oncologist is treating a disease. And again, Jung said that 100 years ago. The diagnosis helps the doctor, but it doesn't help the patient. For there, the key thing is the story. Okay? And that's what I woke up to, treating people and their lives. And I could hold up a bunch of magazines in front of you. They all have me on the cover, but they also have the controversial Dr. Siegel. This is from, I think, the 1990s. Why was I controversial? Because I talked about patients and their feelings and their emotions. Oh, you're blaming your patients for getting sick. No, I'm not blaming them. I'm helping them to get well. You know, we have more illnesses, heart attacks, strokes, suicides on Monday morning. If everybody loved their life, Monday wouldn't be a problem, you know? So I began to see how you could relate your life to your health. And when people had a meaning in their life, they survived. And again, that's what got me to start writing, because when you realize there are a lot of people that you thought were dead aren't. Now, how did I realize this? If people stop coming to the office, I mean, I never predicted to somebody, you have 3 months to live, because I knew that killed them. They went home depressed. I mean, one man, the insurance company, refused to pay for cataract surgery because he had lung cancer. They said, we're not going to spend money on cataracts. You'll be dead in a year. He went home and died in a week because he had no life if he couldn't see. So, you know, that's the kind of thing I realized. But on the other hand, there were people I thought were dead who showed up at my lectures. Or when I called up to say, how come I wasn't invited to the funeral? They answered the phone, you see. And things like, oh, it's so beautiful here, I forgot to die. That's somebody who moved to the mountains of Colorado. Somebody else bought a house on the ocean in Miami. Another one got a dog and put it in a backyard wildlife habitat. And these are quotes from people. Yeah, and the millionaire who moved into this house in Miami, he was introducing me for a lecture one time down in Miami. It's this big church filled with hundreds of people, and he shows up, you know, in all this casual clothing, like, where the hell are you going? So I said to him, how could you dress like this for this event? He said, when they tell you you have a few months to live, you cancel the dress code at work. See, and those were the things that they were teaching me. Because he said, I told all my employees, I don't care what you wear to work. You know, I'm not going to worry about what I'm wearing. If they tell me I have 3 months to live, who cares about a suit and a tie? And he lived for 5.5 years and changed his hospital because he impressed them that I'm living because of me, not you and your treatment. And that's the things I've learned. And one other, that's a simple thing for people to do. When you have a problem in your life, whether it's contributing to your health or not, if you have a problem, say to yourself, how would I describe this problem to people? What I'm going through. An example in my own life, I was having vertigo attacks, dizzy spells years ago. And one morning I got up and I thought, hey, dumbbell, why don't you do what your patients do? What's it like to have vertigo? Well, the world is spinning around. So what do you have to do? You have to lie down. And then it hit me. That's right. You're doing too damn much. So your body is saying to you, I'm going to make you rest. It was really impressive for me to live the sermon and suddenly become enlightened about why I'm having that problem. Somebody whose pain was described as pressure, it turns out her marriage was the pressure in her life. The pain disappeared and she went home from the hospital. Oh, failure. Well, my body failed. She had cancer. I said, but how does failure fit your life? My parents committed suicide when I was a child. I must have been a failure as a child. So, some of those words really impact you. But, people's eyes would bulge and they'd say, thank you. And they'd get up and go home. They didn't need to talk to me for an hour. It was very clear to them, what do I need to work out in my life to heal myself? The byproduct is your health, but the key was get that life straightened out. And then the byproduct is the health. And that's why I say psychiatrists, one of them wrote a list of personality characteristics and called it an immune competent personality. And that's when AIDS epidemic came out, no different than the coronavirus now. He said he noticed some people did very well and we had no treatment for it. And when he looked at their personalities, they had the same characteristics. And some of the important ones were, you can ask for help. You can say no if you don't want to do something. These were just basic questions about relationships and life and so forth. And so he published that. Oh, and I recall one other psychiatrist who thought I was a nutcase, the controversial Dr. Siegel. He said, he's crazy. What's he doing? Well, why should be sitting in a group help people survive? So he said, I'm going to start a group and do a study that it doesn't mean anything, because nobody would support research. When I said American Cancer Society, National Institutes of Health, I said, instead of calling me controversial, why don't you put up a few bucks? I'll run a study and we'll see if it makes a difference. Oh, no, that's crazy. We don't believe in you. So this guy said, I don't believe in you and I'm going to prove you're wrong. He started two groups of women. One was the control group who did not have any meetings. The other was this therapy group where he met with them regularly for a year. At the end of the year, he was struck by the fact that his meeting group had a much better survival rate than the other group of women. I think there were about 12 women in each group. And he was honest enough to publish it and say, Siegel's right, and become a supporter of me and start doing more work that way. Because I know when he was in the audience, when I would speak before he'd done the study, he would sit there just shaking his head, no, no, no. No matter what I said, he'd shake his head, no. And then he did the study and then his head's going, yes, So that's the part. If people, instead of just criticizing you because of what they believe, test it, see what happens. And then you begin to realize there is a survivor personality. And the other thing that was interesting, why it's hard to get this out there. When I sent articles about patients and the things I was doing, the psychiatry journals sent it back saying it's appropriate, but it isn't interesting. The medical journals sent it back saying it's interesting, but it's not appropriate. See, and that again is the problem. What the psychiatrists are aware of, your doctor isn't. So he's not treating you as a whole person. You know, it's like I'm treating your body and your disease, and the psychiatrist is treating your emotions and your mind. Well, that's the same person with both parts. We need to connect them and treat people in that holistic, that's the word that came up when we started American Holistic Medical Association. Because I began to meet doctors. Part of it was my wife developed multiple sclerosis many decades ago. And again, what does her neurologist tell me? You know, this is what's going to happen to your wife. And the thing that blew my mind was he told me to meet him in the hospital cafeteria to talk about my wife. And I thought, why are we meeting in the hospital cafeteria? Why didn't you say, come over to my office? But then I realized he doesn't want to deal with my emotions. So if he has me sitting in the hospital cafeteria, I'm just going to sit and listen. And according to him, I'll be a single father with 5 children, you know, because of what happened to my wife. Well, that's when I began to research and do more things, you know, in a complete way, not just about cancer patients in my office. And I realized there were so many intelligent, well-trained doctors who were different, you know, who were holistic, who offered you more. And the multiple sclerosis never became a threat, you know, to my wife's life. I mean, I have to say, my wife died 2 years ago of a heart problem, but she still lived way beyond what anybody else ever predicted. And I think when she got tired, quietly in her sleep, she died. Because that's another thing I noticed, that people have a lot of control over when they die. That if they get tired of their body, then they let you know. I mean, in our family, people would say, you know, I'm dying Sunday. I'm not eating dinner tonight. And, you know, all those things, we knew what they were saying. Because my father-in-law died at 98, and I was trying to get him to live to be 100 and get him on television because he was quadriplegic from an injury. And, I mean, he was such a teacher for me about surviving. I mean, anybody with all his problems would probably said, why do I want to live? What's the point of it? But he was full of life and humor. And but one night he said, no dinner tonight, no pills. And he didn't want to buy my package and live to be 100. So he went to sleep that night, literally. But he had a lot of advice for me when I would say, what can I teach patients? And he taught me also how much your care is a factor in your survival. Because many years before he died, I thought he was about to die in this nursing home he was in, because it got beyond what we could manage at home. And I said, I'm moving him to a new nursing home that was just built, maybe 3 or 4 miles from our house. I said, then we can all be with him the last few days of his life. And they said, if you move him, you'll have to pay his bills. You're not his doctor. I said, look, he's got a couple of weeks to live. I can afford it. I'm moving him. So I moved him to the new nursing home. Within about 5 days, he stopped dying. He was eating again, no problems with food, feeling better, cheerful. And I thought, you have a problem. If he lives a few more years, you will have no money. But I didn't want to upset him. So I just went in and said to him one day, how come you're not dying anymore? And I never forget his answer. He said, I was dying to make them happy at the other nursing home. They were tired of taking care of me.
Wow.
Within about a year, the state took over, you know, paying his bills again. And it saved me. But when I heard those words, you see, again, it emphasized what I was believing, how much your life affects your health and will to live. There was one more story. Forgive me, I never stopped telling stories, but the reason I tell stories is they're true. You can't argue with me and say, that's not statistically valid. It's a story. And this was from a nurse, like after my lectures, people would come up to tell me more stories. She said, it was a he, excuse me. He said he was taking care of a woman who also had paralysis and couldn't get out of bed and couldn't walk. And because he was the male nurse, he could lift her out of a wheelchair and put her in bed and pick her up when he came on duty the next morning. But he said every time I put her in bed in the evening before I left, she would start in, does God forgive you for your sins? Does God forgive you? And he would say, look, I keep telling you God will forgive you. I had a near-death experience. I know what it's like. I know God will forgive you. Why do you keep asking this every night? Because I stole my parents' silver so I would have money to get married, and I never told them anything about it. Mm-hmm. Will God forgive me? Yes. He said, the next morning I came in, there was a note on my locker to see the superintendent. I go over, I said, what's the note for? What did you tell her last night? I told her God would forgive her. Why? She came out of her room carrying her teeth and her Bible, and with no help, walked the whole length of the nursing home, put them on the desk, and told the nurses, I don't need these anymore. Walked back to her room, climbed into bed, laid down, and died. Yeah. And when you have an experience like that, you can't deny how this woman that he was picking up, lifting, carrying, suddenly walks the whole length of the nursing home and blows everybody's mind. But once she had that forgiveness, it changed her and her life, and she was able to go on in peace and let go.
Amazing.
So,
amazing.
I mean, we all have that potential to, as my mother used to say, let your heart make up your mind. It's the parents you grow up with are the ones who are either your therapist or who destroy you. Because if you grow up with love, what a difference it makes. I always say the messages I grew up with, do what makes you happy. Mm-hmm. Now, I must say, as a kid, this drove me crazy because I wanted help from my parents, and they never seemed to help me. I have to make a decision. I need to know what to do. Do what makes you happy. That's it. That's your help. Something went wrong today, Ma. It was a horrible day at school. God is redirecting you. Something good will come of this. Ma, did you listen to me? I had a horrible day. Yes, God is redirecting you. And I've learned from more spiritual leaders, those are the kinds of parents they had. What's his name? I'm trying to think. He was a friend in the church in New York. But anyway, it'll come to me. But he said what his mother used to say is, Norman, if God slams one door, further down the corridor, another will be open. You see, so you're looking for sympathy, for help, and what are your parents doing? Really framing a new attitude, a new sense about life. And as Elizabeth Kubler-Ross said to me years ago, there are no coincidences. And Jung used to say, the future is unconsciously prepared long in advance and therefore can be guessed by clairvoyance. So a lot of times when something goes wrong, it may put you in a situation to straighten out things and make them go right, so you don't see it as a curse. I always say what I call spiritual flat tire. You get a flat on the way to the airport, you miss your plane. But when you get to the airport, you find out the plane you missed crashed. On 9/11, way back when, there were so many people who realized they were alive because they got to work late when the plane crashed into the building. Picking up something at the grocery, taking my kid to school, things I don't normally do. But you get to work late and you're alive. Mm-hmm. And so God can be redirecting you and all those. And the other was that finances were to make it a better world for everybody. because lottery winners, 95% in a study that was done 5 years after they won, said it was one of the worst things that ever happened to them.
Really?
Yeah. And it's because of what happens. In other words, what do people want from you? You know, it's like if you have, say, 3 brothers and you win the lottery, they all show up. Hey, I could use some of that. I need a new house. I need a car. I need or you gave him more than you gave me. What do you do? Yeah. So they would end up in conflict with their family over it. But if they knew it was to help them help their family, then they wouldn't have a problem giving, you know, and helping others too. And my father learned that because his father died of TB when he was 12, leaving a wife and 6 kids with nothing. And I never forget my father's words. When I heard him say, one of the best things that happened to me was my father dying when I was 12 years old. When I was alone with him, I said, what the hell are you talking about? I knew from stories what you went through with your mother and your brothers and sisters. He said, yeah, but it taught me what was important about life. And he was one of the sweetest, gentlest men you ever want to meet. And he taught me something else too, because I got married when I was in college. I didn't have any money or anything. So I had to ask him for help all the time. Mm-hmm. And I finally said to him, you know, I'm feeling guilty. It's so hard to ask you for anything, you know, to help pay the rent and apartment, things like that. And he said, don't worry. If I don't want to help you, I'll say no. That's why he was such a wonderful guy and such a good teacher. So then I didn't have to feel guilty. I could say, hey, can I this, can I that? And I knew he'd say no if he didn't think it was appropriate or proper or didn't want to help. And it was wonderful. I mean, there's a smile on my face because I felt guilty anyway. And when my wife and I would pick an apartment out, I can assure you, it was in a poor neighborhood with low rent. And I remember my mother coming to our apartment and saying, why are you living in this place? I said, because Dad's paying the rent and I feel guilty being on the top floor of some, you know, wonderful hotel or apartment house. Yeah. Why are you living here? That was my mother's comment. Right? But again, he was a wonderful teacher. He never criticized. One other story, if you have time for it. I broke a neighbor's toy because I was jealous over what he had and I didn't have it. It was some fancy thing. And his parents came over to tell my folks what I did. And they all knew it was out of jealousy. But the thing I remembered was my parents didn't yell at me, didn't tell me I was a terrible kid. What am I doing? They said, okay, you know, we'll get another one for your son. My father comes home from work the next day. I was sitting in the front of the house outside. He walks over to me, and I never forget his words. He took that toy, handed it to me, and said, I know you wanted one of these. Mm-hmm. Oh, brother. He handed it to me. I know you wanted one of these. He didn't buy 2 of them, but I know you wanted one. And I thought, I could keep this, and he would be disappointed in me, I know, but he wouldn't have yelled at me and said, you did the wrong thing. And that kind of pressure, though, was enormous. You know, knowing what was right and pleasing this wonderful man, how could I not do the right thing? So I got up and took the toy over to the neighbor. But, you know, it impressed me later in my life because I realized how lucky I was to grow up with those parents. That when you begin to learn about the suicide rate in high school students and what they grew up with, the abuse and the punishment, I help people who are suicidal by becoming their chosen parent. Yeah. You know, because that was a label I got. You're my CD. I said, what the hell is that? You're my chosen dad. And now I have a card from Father's Day that my bonus dad. That was in another term. I loved it. A bonus dad. And these people are alive because I said, I love you. And we connected. And it meant something to them to feel that love and have a meaning, reason. And what I do at schools, and it works, because a lot of times parents and teachers get scared. I will say to the kids, tonight's homework, you write a suicide note on why you should commit suicide, and you write a love note. Why am I worth loving? And bring them in tomorrow. Wow. You don't have to put your name on them. And a lot of the teachers say, what are you doing? They'll go home and kill them. I said, watch. The kids come in the next day. I say, on that side of the desk, you put the suicide note. On the right side, you put the love. And what do the kids see? The suicide pile is about 4 times higher than the love pile.
Really?
Then the suicide rate in the school goes down, literally.
Wow. Because
the kids realize I'm not alone. I could talk to them about this. And then it becomes like a therapy group in the classroom, not a lying group. Mm-hmm. Because, I would listen to kids. How come you got a black and blue? Oh, I fell off my bike. When they realize they're not the only one, they stop lying and they say, my drunken father punched me. See? And then people begin to know the truth about what they're going through and help them. Whereas when you're telling lies, and one kid who really taught me what love is about, my phone rang and he said, Dr. Siegel, I'm going to commit suicide. I said, Tony, I'll get you a gun. We'll kill your parents. That's what the other kids are doing. And this sentence blew me away. He said, no, I never want to be like them. Because he'd been sexually abused. His bedroom was empty unless he did people a favor. Then he'd get a TV for the night or something like that. It was horrible what he was living. And he wrote a book called A Rock and a Hard Place. Now, it's obvious if he wrote a book, he didn't end up committing suicide, but he said, I'm going to go commit suicide. I'm going to jump in front of the A train, the subway. Goodbye. A couple hours later, the phone rang, and it was Tony. I said, Tony, I thought you were going to commit suicide. He said, the train never showed up. That's when a no coincidence. You know what I mean? Yeah. It's like God said, I got to save this kid. Mm-hmm. So he said there was on one of the cards on the wall of the station was the suicide hotline. So I called them, and they came and rescued me and told me about love. Mm-hmm. And that's the part gives me faith, I'm going to commit suicide, but the train doesn't show up.
Oh my God. Well, I'm only supposed to write one song about you, but I think it's going to have to be an album here. Mm. So many stories there.
Oh, I can't help it. You know what I mean? It's stored up in me.
Sure.
And it flows out. And when people time limit me, there's one program I was on, the woman said, this is a very interactive show. We love to be up and back and up and back. And after a while, she's got a big grin on her face. And I said, there was a commercial break. I said, what are you laughing about? Something you can see in the studio? She said, no, I'm laughing about you. I said, this is an interactive program and you didn't stop talking for 20 minutes. Yeah, and on public TV, they used to say to me, Bernie, stop talking. Nobody's donating. They're all listening to you.
Oh, my God.
So there are some bad, components to the stories. But if it touches people's hearts and they're willing to change, it makes a difference. Well, to not fear failing.
No.
You know what I mean? If you want to, because I work with drawings, reading books, different things, meetings. But when people are afraid I'll do it wrong and don't show up, that's what's tragic and sad. And I say, it's not about failing. It's about participating. Give it a shot.
I think you wouldn't be such a great doctor if you weren't a great listener.
Yeah. Well, Helen Keller taught me that. She's one of my teachers. Because she never blamed God for punishing her, her blindness, deafness from before she's 3 years old. She's just wonderful. But the biggest lesson, well, I'll give it to you, the test. You have to be blind or deaf tomorrow morning. What would you choose to be?
Well, I'm a musician, so.
Yeah.
Yeah.
The musicians are the only group who say, I prefer blindness.
Mm.
Every other group says deaf. I want to be deaf.
Mm.
Yeah. And Helen Keller said that her quote, I've heard of the stars of the rainbows, of the play of light on the waves. These I would like to see, but far more than sight, I wish for my ears to be open. The voice of a friend, the imaginations of Mozart. Life without these is darker by far than blindness. And that's something I learned. If you want to help people, you have to listen to them. See, then they hear what their problem is. I mean, I've had people say to me, and I didn't say a word through the whole time. They started talking about their troubles, and I would just go, At the end of their conversation, of God knows how long, they'd say, thank you. That was the greatest conversation I've had with anyone. And I never said a word. But I learned from Helen Keller, what they did was hear themselves. Mm-hmm. So I learned if I can listen to people, they hear the truth for the first time. And then I get credit for it. It's not me saying, no, what you need to do is this. Oh, that was a bad choice. Oh, you should have done this. Oh, why did you? No, I just go, And then they thank you because they've heard themselves and they know what they need to do. Mm-hmm. They don't need me to tell them.
Last week on the show, I had Stephen C. Hayes, a psychiatrist he developed the ACT. Have you heard of that? The acceptance and commitment therapy?
No.
He's a psychotherapist and he gets people to listen to the voice in their head, and all that comes from that. So you're saying the same thing.
That's why I say the psychiatrists are doing it. Yeah. But if you're not trained to be a psychiatrist, you don't listen. You tell people you need to take this medicine, you need an operation, you need to change your diet, you need to exercise, but unless you get them to know themselves, they're not going to follow your prescription.
So if someone walks into your office when you were practicing, could you tell straight away if after listening to for 5 minutes, if they were gonna survive or thrive or not make it?
Yeah, because there's one lady you reminded me of. She came to me and said, I need surgery. I looked at her record. She was having surgery multiple times a year.
Wow.
And I thought, this is not normal. She's doing this to, what shall I say, abuse herself. She was punishing herself for something. So she'd get cut up every few months. Oh my God. And I said to her, this can't be normal, I'm not going to operate on you. Now, how did she get people? She would keep complaining. It's like if she came to you and said, my knee hurts, and never stopped coming in saying my knee hurts. What most doctors did after a while say, all right, I'll operate on your knee. See? And I said, I'm not going to operate on you. If you want to come in and talk with me, I'll try to help you get over this problem. And she looked at me like, oh my God, he knows me. I mean, she had a look on her face like he knows. Mm-hmm. So she said, yes, I'll come and talk to you. And she started coming in regularly, like you would to a therapist. The thing that blew me away was the insurance company sent me a letter. We do not pay surgeons for talking. My sense of humor, I didn't get upset. I wrote them a note. I said, look at her record. I have saved you a lot of money this year. That she is punishing herself. And I realized that. So I'm helping her to get over that kind of behavior. and a letter from the insurance company came saying, keep talking. Well, I thought at least they were real people. You know what I mean?
Yeah.
It got through to them what I was saying, and keep talking. Yeah.
So you've written so many books about how to help yourselves. But if you're retired now, people can't go to see you. But if somebody gets the dreaded cancer diagnosis now, what would you say to them? How can they help themselves?
Well, first I'd give them homework. Let's put it this way. What are you experiencing? What's happened in your life in the last year or two? Draw a picture of yourself, your disease, your treatment, and your immune system. Because that's something I learned from Elizabeth Kubler-Ross.
Really?
Because I drew a picture for her, and just so you understand, I drew an outdoor scene. She said, what are you covering up? I said, what are you talking about? Bernie, you used a white crayon to make snow on a mountain. The page is white. What do you need a crayon for? You added a layer. What are you covering up? Boy, that was another aspect of changing my life. I drew the simple picture and she knew more about my life. Even numbers, as Jung said, they are quantity and meaning. Bernie, why is 11 important? Well, I've been doing this work 11 months. That was my immediate answer. So every time she'd ask me a question, it's like, where the hell's that coming from? Well, you're drawing. So I went back to the hospital with a box of crayons and asked people to do drawings. And it was unbelievable what you learn. I mean, I have a book called The Art of Healing with drawings in it, to help people. But I'm not the first person to put a book out like that. I read other books too, by art therapists. But you see, again, the art therapist doesn't know medicine and anatomy. So they're helping you psychologically. If you draw your treatment as the devil giving you poison, everybody knows you're going to have side effects and problems of your treatment. Whereas if it's a gift from God, those were called Siegel's crazy patients. I had patients who had no side effects to radiation, chemotherapy, woke up after surgery with no pain. And the nurses would say, your patients are a problem. They're refusing medication. I said, maybe they don't need it. You ever think about that? It's like, what are you, nuts? But the people saw the treatment as a gift and had no side effects. And it taught the doctors something, you see. Then my crazy patients became a pleasure to take care of. Rather than, is the radiation machine broken? Did the nurse forget to put the chemotherapy in the intravenous? They realized if Siegel's name is in the chart, don't worry, it's one of his crazy patients. And I let them know that their mind has the potential to do this for them. So if you picture things as being a gift and not having side effects and doing beautifully, your body believes that. So when you go for treatment, your body already has experienced it as far as it's concerned and doesn't have any problems. It's amazing. And how doctors say things to patients also. When you talk about chemotherapy as poison, or radiation can burn you, or fighting a war against a disease, and if you're a loser, it's about healing. And when you focus people on the healing, then anything can participate in the healing. And that I know. And, as I said, even with my wife, I didn't mind lying to my wife for her benefit. See? And one of my articles on my website, BernieSiegelMD.com, is deceiving people into health. So you mentioned, I went to, out in Pittsburgh at the Children's Hospital. I trained in pediatric surgery. And kids trust you. It's easier to work with them than adults because when you lie to a child, they believe you. So I always say the simplest one that I tell people to do, you take an alcohol sponge, you know how they rub your skin before they stick a needle in.
Yep.
And you say to the kids, this will numb your skin. It's a brand new kind of sponge. You're so lucky they just came up with this. Cleans it and numbs it. 80% of the kids would say, oh, why don't the other doctors do that? About 20% say, I felt it. But you know what I mean? It wasn't any big thing. I felt it. Oh, bad sponge. You know, so it wasn't me lying. It was a bad sponge. And it was wonderful. And I tell the nurses and the, you know, the hemostat, not the hemostats, the hemotechnology people who are drawing blood in stations that you go to, lie to people. And you'll be amazed at how many of them say, thank you. And I taught parents how to lie. See, if you're a kid and you say, I'm feeling sick to my stomach from my treatment. Oh, here's your pill. It's a vitamin pill, but they put on it nausea pill. So the kids think, and 90% of the kids are feeling better in half an hour. Yeah. Wow. And I know adults who came and would tell me stories where their family members, these are people with visual problems, so they always had to call their family to get them a pill. And they learned they were given the wrong pills by their family, but it straightened out all their problems because they thought they were getting the right pill. Wow. So when they had glasses on or they saw the jar that they were taking it from, you know, the mother, this was one case, said to her daughter, you gave me the wrong pill. And she said, Ma, it worked beautifully a few hours ago. Because the mother believed she was getting the correct treatment, see?
But I mean, the American medical industry is so conservative and so, you know, you're virtually a pharmacist when you're a doctor. I mean, how did you get on being a radical, you know, because you were
Well, it's because I was meeting with the patients. They were my teachers. See, I started support groups. So every week I sat with God knows how many people, 2 or 3 groups, 15,
like after work,
people a day. Yeah. You know, my day off, I sat with support groups. Wow. And I saw what the patients who did well were like. So I started spreading the word and initiating that with all my patients. See, because I said to them, if you want to join the group, you got to read a book, draw a picture, come to a meeting.
You can do that.
Yeah. But most people didn't come. He wants you to read a book. He wants you to draw pictures. Oh, and I had a set of questions, you know, like what does disease mean to you and what happened last year or 2 in your life? And they said, no, I'm not an artist and I don't have time to read a book.
Just give me the pill, doc.
Yeah. And that's what shocked me because when we sent 100 letters to people saying, you want to live a longer, better life, come to a meeting. I couldn't sleep thinking, what am I going to do with 200 or 300 people? And 12 women showed up. That tells you about survivors. You see, 88% of the people don't show up. And then the 12%, my wife was one who labeled them exceptional patients. And I thought that is exactly what they are. So they show up and the really exceptional ones would call you like Tuesday afternoon and say, oh, I want to join your group. I said, okay, you have to fill out these questions, read my book, Love, Medicine, Miracles, and draw pictures. Okay, when's your next meeting? It's tomorrow. All right. I said, excuse me, you have to read the book, draw a picture. Yeah, I'll sit up tonight and do all that. Now that's somebody who doesn't die when they're supposed to, see?
Right.
And somebody else came in and said, I'm not an artist, so I have my 12-year-old son draw the pictures for me. I mean, what kind of attitude is that? You know, you're going to face cancer, but you can't draw a picture. You'll get a poor grade. I mean, it was just absurd. But that's what taught me about people. And you're not taught about people in medical school. See, when you ask, and the other side of the coin, when I talk to medical students, and they're the ones who would say, would you come to our hospital, our medical school, not the staff, you know, not the teachers. I'd say, draw yourself working as a doctor. And it blew my mind away. Why? over 90% of the drawings don't have a patient in the picture.
Wow.
You're sitting behind a desk, your diploma's on the wall. One drawing that touched my heart showed this young man kneeling in front of a wheelchair, arm around the patient, handing her a tissue. See, he knows what it's like to be a doctor. He's serving her, caring for her. Some of the drawings even didn't have a person in them. Computers, equipment, a picture full of stuff. And I couldn't believe that this is what they drew. But it was a way with students, I would help them pick out specialties too. I'd say, what do you think you want to do after you finish medical school? I could be a surgeon, I could be a cardiologist, I could be this. I'd say, draw yourself as each one. Let's see what they look like. And it really would help them. Because which, patients are they close to, or is it the machinery they're interested in? Because it helped them know why they were interested in something and going to choose it as a profession. And to one more story, one of the students drew 3 pictures: family doctor, radiation therapist, surgeon. And the family doctor, which is, see, what I would have told him to be, he was a caring student. When he was with the patient, it was like there were so many things on his mind he'd written in all these words. He wasn't touching the patient and he wasn't home with his family that he put on the part of the page that shows the future, because he wasn't married at that time. But he showed a woman and 3 kids in that part, but he wasn't home with them and he wasn't really with his patient. The other was as a surgeon. He's all masked and standing there with nobody else in the picture. As a radiation oncologist, it really surprised me because it was a beautiful picture. He was with the patient, touching, holding hands, discussing things. It wasn't about all the equipment. So I said to him, you ought to be a radiation oncologist. And that's what he went and did. A few years later, I get a call. Yeah, what is it, Matt? We're having trouble. My wife just doesn't seem able to become pregnant, no matter what we've been doing. I said, Matt, you're going to have 3 kids. It was in your picture. I said, I can't tell you whether they'll be adopted or yours, but you're going to have 3 kids. And a few years later, I hear from Matt that we got 3 kids. And that's the part, you see, that fascinates me about that kind of work. That art therapists aren't so informed about that. They're using art as a form of therapy. They're not interpreting it as a Jungian therapist. So there's past, present, and future, and you literally show your body parts. I mean, I have operated on people because of the drawing they did, and I have not operated on people because when I looked, I knew this is not a surgical problem from their drawing. And you see, again, what changed the doctors at the hospital where I was working at Yale New Haven Hospital and St. Raphael's was the drawings by the patients, because they could see what I was seeing. They even made a coloring book at an outpatient surgical center. So every kid that came in did all these pages. And again, let me explain what I mean. It says at the bottom of the page what the scene is showing. You'll meet a man or woman called an anesthesiologist who's dressed in a green outfit that looks like pajamas. Mm-hmm. Kid comes in. I look at his drawing. He has drawn the anesthesiologist in red. I said to the anesthesiologist, we got a problem here. He said, yes, Bernie, his mother has muscular dystrophy. He may have an adverse reaction to muscle relaxants if he has an abnormal gene, and it could endanger his life. So I said, turn to the last page. If he pictures himself purple, a spiritual color, I'm sending him home. I'm not going to take a chance and operate on him. The last page showed he was okay, but not happy. Some red and black. I don't like what you did. I'm hurting. I want to go home kind of thing. Mm-hmm. So we operated and he was fine. And there was another kid who drew the operating room she'd never been in. And I mean that literally. Here, draw a picture. She drew the operating room, the table, the lights, the people. You know, when the staff looks at it, and it's like, how does she know? But she knows intuitively, unconsciously. We know. And so people were converted by the drawings. Yeah. And a lot of doctors, you know, they may have called my patients Siegel's crazy patients, but they always gave them, to quote one doctor, I know you and your crazy patients. I agree with her physician that she has about, you know, a few weeks to live, but I know you and your crazy patients, so I'll give her hope. Because this was a woman who was told down in North Carolina by her doctor, she'll be dead in 2 months and don't bother to get treatment. You'll just feel worse. So a relative told her to come up here to get well with Dr. Siegel, which didn't make me happy because I felt, well, this is a burden, you know, but I realized it's like hypnotic. I wouldn't complain about it if I heard it today. And I asked my oncologist friends who were used to my crazy patients to see her. And they said, we agree, she's got a couple of months to live. But this is how his letter to me, his note to me ended. But we know you and your crazy patients, so I'll give her hope. Then I would get a note every week from him when she came in, doing well, very well. By the 6th week, his note said, in complete remission. Isn't chemotherapy wonderful? Now that's his smile, you know. But in 6 weeks, she was in complete remission. Now, when somebody said to her, how come that happened? Dr. Siegel sat on my bed and hugged me. I knew I'd get better. And there was just a study done recently. I should have saved the email I got, but it said that patients who were put into the program with meditation and, you know, visualization and all kinds of things spent, I think it was 3 days less in the hospital and saved something like $3,000 on their hospital bill. And, you know, my reaction was, yeah, I did that 40 years ago and everybody said I was crazy, you know? Yeah. And that kind of thing, I mean, you don't see it everywhere with everybody excited about it, but yes, put it in every hospital. Yeah. You know, the government ought to be supporting it. I never got any support from the government, you know, to do research, to show that you can save money and get people well. You know, either you had to fill out 150 pages of forms, you know, to submit something. And I couldn't do that. I mean, I didn't have the time. I didn't have an office staff. I'm a surgeon. Yeah.
Yeah. It's amazing you found the time that you did to write those books and everything.
A lot of students used to come to work with me. You know, they spent a month. And Yale asked me, why are these students coming? I said, I told you I could be a course here. And you gave me so many pages to fill out. I told you, forget it. The students are coming. I'm not going to fill out pages just to get a label as a course. You see, this is the part that fascinates me about all the technology. They said, okay, we'll make you a course. I didn't have to fill out one piece of paper. They made me a course. Why? Because now they could gain some of the popularity that Siegel had. People could be going to Yale where Siegel was. And that's the part, you know, I didn't complain about it, fine. And the title of my course was Surgery, Mechanical or Healing Art. And the students would spend, you know, from morning till night with me, watching how I acted and interacted with patients. And the nice part is, something doctors don't have, I'd have a critic with me, because I loved it if they said to me, you know, you didn't really hear what the patient was saying. You didn't answer a question. And I'd say, let's go back. And we'd go back in the patient's room, and the patient would always agree, yeah, the student's right. You didn't answer. So I'd say, all right, what's your question? What are you looking for? And I loved it, you know, to give that service to the patient. And I know they always thought, wow, isn't that nice? He came back to talk to me, to help me. But it's because we had this third person there who could see what was going on. And doctors don't have third person. So it's easy for them to say, no, it's not my problem. It's not my fault. You're the one. Nobody else ever complains. Because I always say this to people. If you get a new doctor, say, are you criticized by patients, family, and nurses? And the best ones say yes, because they're learning from their mistakes. I mean it. I've never had problems with the doctors I know who are like that. I say, you criticized by patients, family, and nurses? Yes. Why? Well, I knew you'd say yes. Because a lot of people standing around get upset that I ask a question like that. But I say, no, I knew he'd say yes. Because he's learning from his mistakes. And they're coaching him and teaching him. Because if you've never been a patient, you don't know what the patient is experiencing and going through. So I learned to listen. And I have to say, my family, my wife, they were good critics. And it isn't saying you're a lousy doctor, you're a lousy husband, you're a terrible father. There's a better way of doing it, kind of thing. In other words, they're coaching you. Let's put it that way. The coach doesn't tell you what's wrong with you. He tells you how to be better. So I learned that we could all do that with each other and give each other hugs too. So patients would hug me when they knew I needed something.
Wow. I noticed on your website, you dedicate a space to your wife, Bobbie, who died 2 years ago.
Yeah.
She seems like a real inspiration in your life.
Well, just to show you how mind body, one morning I went to get her up. I would get up early, take care of, have a house full of pets and all kinds of things, and then go back to get her up. And I went in, I thought she was still asleep because she looked totally peaceful. A little shade over her eyes to keep it, dark and that kind of thing. But when I took her hand, it was ice cold. Mm-hmm. And boy, did I feel something in my body I've never felt before. I don't know how to describe it, but just like through my whole body, and especially in the chest. And then 9 months later, my heart started beating irregularly. And it seemed, this is exactly what I'm preaching and teaching. Your loved one dies. What part of your body is responding? Your heart, your love symbol. And it was irregular rhythm. And that was corrected. So it's back again. But it just, again, seemed to substantiate everything I was preaching. When my wife dies, what part of me goes wrong? I didn't get cancer or an ulcer or high blood pressure. My heart went nuts. Mm-hmm. And so they, calmed it down with certain treatments and medication. I'm not on anything. Well, I'm on an aspirin to keep your blood thin. But in case it came back, it's called auricular fibrillation. But that was corrected and everything's fine again. And I'm living normally and active and everything else. But it just emphasized to me that everything you're preaching is real and true because you are an example of what you're teaching and preaching to people and asking them. If my doctor had said to me, what's happened in your life? I would have said, yeah, my wife died. And now my heart is responding to my loss. Yeah.
But you think she's still around? She's still close to you?
Oh, boy. You want to have another program? We'll do that. The mystical experiences I've had are incredible. There is no question she's around. I mean, I keep her picture over my heart, but I don't know if you could see these, but it's a dime and a penny. Mm-hmm. What day of the month do you think we were married on?
11?
Yes. I have found probably 8 or 9 dimes and pennies together since she died. Now, where in things like a bird bath in our yard filled with dirty water and leaves. And a voice said, clean it out. I dump it out. There's a dime and a penny. Go to the supermarket, go to counter number 2. I go there, there's a dime and a penny on the checkout belt. But the one that really has convinced me about the mystical world and things I used to think were crazy on television programs, about spirits and houses. And I go, we're still sleeping in the same bed. And in the morning I get up, go to the other side, to even it out, pull things back. And I picked up all the sheets and blankets, and they literally were pulled out of my hands and folded over the other side of the bed. And what do you think is lying on the mattress?
Dime and a penny.
A dime and a penny.
Wow.
Now, nobody's going to say, oh, well, you got in bed with your pocket. This is underneath, not on the top blanket,
Yeah.
And another time, a dime and a penny were in our clothes dryer. And the clothes there, it wasn't clothes, it was towels and rags and all kinds of things with no money. But when I picked it all out after it was dry, there's a dime and a penny still there. And those were done around the Mother's Day weekend, because the Mother's Day weekend was 9, 10, 11. So the 9th, my wife was born on 9/9. Sunday was Mother's Day, and the 11th was Monday, and I found more dime and a penny. And let me say this too, because it really convinced me. I go to the emergency room when my heart was beating irregularly. What room do you think they put me in the emergency room?
11.
No. The voice said, put him in room 9. See, my wife's birthday. Then they said, we don't have a bed upstairs for you yet. Next morning, we got one. You go upstairs, 819. See? So it adds up to 99, and 8 is a new beginning. Then I noticed something. You get a wristband put on you when you go to the hospital or the doctor every visit. Every single visit. It is added up to 9s. See, my number is an 8 for a new beginning.
Okay.
2 9s, 2 6s, 2 3s. Everything adds up to 9.
Yeah.
And the case number also now always adds up to 9s. Except one day I went to the doctor's office and it didn't add up to 9. And I didn't stop. I was just upset. But then later I looked at it and I realized, hey, dumbbell, it adds up to 7/11, your anniversary. So every single time it adds up to, almost every time is the 9/9, but every now and then you'll get a 7/11. And one other mystical, after she died for a couple of months, I would get a kiss goodnight every night. Now, what I mean by that, think of the sound you make when you blow out a candle. I'm lying in bed and I hear, and I feel a breeze on my face.
Wow.
And that went on for quite a while.
Wow.
And again, these are things that I have no way of explaining. And our whole family, the 5 kids, they've had experiences with the pennies from heaven and things like that too.
Yeah.
So, we're all open to this mystical experience, and her presence is really here. And I think it's true for all families, when you have that loving connection and relationship. And I don't mind telling, families that, look for signs. And particularly something as simple as pennies from heaven. If you start finding dozens of pennies after your loved one dies, they're letting you know they're hanging around, because it started with my mother. And the thing that taught me what it was a grandchild, because I was finding pennies on the way back from going to the mailbox. You see, they weren't in our driveway when I went to get the mail. They were there on the way back. So I knew this is mystical and not explainable. And then this little pipsqueak of a kid was over our house one day, and he says, "Oh, they're pennies from heaven." What made him say that? You know what I mean? That was like a mystery and a miracle itself. But once he said that, it was like, yeah, I get it now. Thank you. So since then, when we find them in places we know they weren't, half an hour ago, like places in the house, and I mean, just everywhere. It's like where I walk the dog the day before, you don't see one. The next day there's one. It's just like somebody's dropping them there for you to pick up.
My guest on next week's show is Lynn Russell, who's done lots of studies into near-death experiences. Do you have any experiences of that?
Yes, I had all these things happen. I am not normal. 4 years old. There are carpenters working in our house who were putting nails in their mouth. In those days, they didn't have machines. I'm in my bed with a cold, and I'm thinking of them. So I thought I'll be a carpenter, a workman. And I had this toy telephone. So I unscrewed the dial and I put everything in my mouth like they did. And I aspirated it and was choking to death. And I can literally say it's the most painful thing I have ever experienced in my life, because your diaphragm and rib muscles are sucking and the pain is incredible because nothing's getting through. My larynx was completely shut down with these pieces stuck in it. And suddenly I had no pain, no problem. And I realized you're not in your body anymore. I'm up, like floating around the ceiling. And it was beautiful. I could see, I could think. I also realized that's not me dying. Because whenever I talked about it, I would hear myself say, the boy on the bed. I never said me. The boy on the bed was dying. I wasn't. And I know I have an angel. I've met him since. Because while I was watching the kid, and I couldn't call for help, because my voice, everything was shut down. So I'm watching him die, and suddenly he vomits. And all the pieces come flying out. And he took a breath, and it's like a vacuum cleaner. I went back in his body. And I yelled. The first words I said were, "Who did that?" Because I was having a wonderful time and wanted to be dead. I mean this literally. And I'm not unusual as far as children are concerned. A lot of kids say, "I was so upset I didn't die. It was so beautiful and interesting." But who did that? And then my mother came in and wasn't in the mood to hear any wonderful experience. She realized he almost choked to death because she could see the pieces in the vomit. But I realized later on in my life, it was a Heimlich maneuver. I have an angel. I wasn't supposed to be dead. So he gave me a squeeze because I could see the boy's body move and then vomit. And I know it was my angel who saved my life. Now, one other meaningful experience, which is why I know I became a surgeon. I'm on the phone with a friend telling her I got an interview, I can't talk, Bernie, why are you living this life? Now, what she was intending was for me to stop doing all these damn things and take it easy. I said to her, "Oh my God." She said, "What's the matter?" I said, I just sort of went into a trance when you said that and had visions of myself as a knight with a sword killing people. Maybe that's why I went into surgery to help people with a knife. Now, that also had a powerful impact on me. And a few weeks later, I was flying cross country by myself, and I went into a trance on the plane. And I saw myself as a knight, and I'm sure it's in Ireland because of other things in my life. My Lord said to me, "Why don't you kill the neighbor's daughter? He's transgressing on our property. I'm in conflict with him all the time. I want to teach him a lesson. I want you to kill his daughter." I said, "Why don't I kill him?" "No, I want to teach him a lesson. Kill his daughter." I said, "What if I refuse? Then I'll kill you." "All right." And I went, and I'll make a long story short, I killed his daughter and her dog in her bedroom at night because I wanted to kill her in her sleep so it wouldn't hurt so much. But who do you think the woman was when she turned over and looked at me because her dog made a noise? It was my wife. I killed my wife. It was my wife in this life. And I literally brought her head back to my Lord. And I said, "All right, you happy now?" He said, "You're the one who did this. I didn't make that choice. You did." Now, I went for therapy. James Hillman, the Jungian therapist. And I started telling him what I just said to you. And he immediately interrupted me. He said, "Bernie, you hear what you're saying?" "What?" "Your Lord. It's your Lord." I said, "Well, he's the Lord of the castle." "No, Bernie, it's your Lord." And boy, did that hit home, because I said, "Oh, I always wondered how Abraham could do what he did. Why didn't he say to God, 'Take me, leave the kid alone'?" He never bargained. You know, Jesus didn't bargain either. He accepted what was happening. And that was a question of faith that I had always struggled with. But I relived it, went into a trance again. "Want you to kill the neighbor's daughter?" "Fine, I'm going." "No, I was just testing your faith. I want to know I can trust you. Bring them here so we can resolve this problem." So I went over and spent time with them. And I said to the woman, "Look, you can trust me. I'm here to try to resolve this and bring you home. I promise nothing will happen to you. I'll stand in front of you all the time." And her father said, "I heard you. I trust you. We'll go." And we went and resolved the problem. And how do we resolve it? Because this had occurred to me years before when I read a story. A guy buys land, is digging it up to plant, and finds a case, pulls it up, and it's filled with jewels. So he calls the owner. He says, "Hey, look what I found here." "No, you take it. You bought the land. It's yours." "No, it's your land." No. A third guy comes by and says, "Hey, you have a son, you have a daughter. Tell them to get married and give them this as a wedding present." That story always had great meaning for me. And then I realized why. Because my Lord, when we're all standing there, said, "You know, I can see that you and this young woman have developed a relationship. So why don't you two get married? We'll give you the land as a gift, and we'll have nothing to fight over." And I really felt that when my wife and I got married, we healed a problem of many generations ago. And when I say about Ireland, it's just funny things that have happened to me. One was a patient of mine who went into labor prematurely, and she called me to come to the hospital just to help her calm down and support her. I told everybody in the room to get the hell out of there, literally, because it was so filled with panic and depression that I thought, there's no way she's going to not have an abortion with this environment. So I yelled, "Get the hell out of here." And they all looked at me like I was insane, but I scared them. So they all ran out of the room. I'm talking about doctors, nurses, family. And I said to her, "We're going to communicate with your uterus. We're going to do a meditation. You'll quiet your uterus and the labor will stop." And we went through this meditation and imagery, and her labor stopped. And she went on to have a full-time delivery. My phone rings. "Bernie." "Yes." "I gave birth to a boy, and we're naming him after you, but we're an Irish family, so his name is Brady." And I don't think that was a coincidence either, if you know what I mean. Yeah. And once when I went to adopt a dog, I walked into the shelter and there was this big husky that had just gotten there that morning. See, I hear voices, and the voice said, go to the animal shelter. So I go down there, and this dog, oh, he just came this morning. What's his name? Brady. All right, I'll take him home. So it's just like the Irish keep showing up, you know?
Yeah.
And I just feel that was a past life of mine that I killed. And the reason also, I think my wife and I are both very much into rescuing animals. I mean, another one of my book, Love, Animals, and Miracles, talks about the Siegel Zoo, because we always rescued animals. And I'm talking about breaking all the zoning laws, you know, in the residential area. But I really felt it was because of the past. When I killed her dog, it affected both of us, and we were now making up for that. I mean, we had ducks and geese, we had goats, skunks, squirrel.
Oh my God.
Birds, all. I mean, one of our kids was into snakes and turtles, and I mean, just every creature. Some exotic pets, something called the kinkajou, which is like a South American nocturnal creature. It's sort of like a monkey and a raccoon crossed. I mean, but veterinarians would call and say, would you take this? This family can't deal with it. And I'd say, sure, I'll come get it. So I would bring everything home, and with the 5 kids and myself, my wife, we would take care of all these creatures. Yeah, we had a pet rabbit. I wrote a story about the pet skunk. I mean, it was de-skunked, so I didn't have to worry about it. But they were all teaching me about forgiveness and love and everything else, because one of the dogs injured the rabbit. And it broke my heart because I felt I hadn't separated them long enough. I stepped out of the house after about 10 days and he grabbed her, you know, like you would a toy, and shook her. But when I went out to find her, because I used to bring her in the evening worrying about predators climbing into our yard, even though it was fenced in. And she would always hide because she didn't want to come in. She wanted to stay out with all the other creatures. And I said to her in my mind, because you can talk to animals, you know, why don't you come in? She said, you don't make the other animals come in. And I said, you're a rabbit. You can't protect yourself the way a cat can, climbing a tree or claws. So that's why. And then she was very good to me and let me pick her up. But one night I went out and I couldn't find her. And I'm yelling the name and yelling and nothing. And the dog that had injured her was lying on the ground. So I went over to pet him. And he was named Furphy because he had a lot of fur. And as I'm petting him, who do you think's lying underneath him? Smudge. And I thought, this is wonderful. She has forgiven him. They are best of friends. He's hiding her so I won't see her and bring her in the house. But that's why I say, you want to know about forgiveness, let the animals teach you. You know, it's not about forgetting, it's about forgiving and what the gift is. And last but not least, all the eggs were hatched in the house in incubators. So they thought our children were their parents. And all these ducks and geese used to try to get on the school bus every day, which the driver wouldn't let them. I mean, he'd laugh, but he would stop them. You know, he didn't get mad at me and say, God damn it, because everybody on the bus would laugh. And when they came back in the afternoon, there were the ducks and geese waiting for the school bus. And when I took some to my mother's house, where she lived with my folks on a lake, the first time I did it, my mother called me and said, the neighbors have a question. What is it? Why do the ducks and geese walk a half a mile up the road out of the lake when a school bus comes by? I said, Ma, they're looking for our children. You're breaking my heart. Now they're looking for our kids and they're not there anymore. But that shows you how real everything is. And an animal intuitive named Amelia Kincaid, you could have her on your show, who has written several books. She's the one who taught me that if you have a quiet mind, you can talk to animals. You talk in your mind they answer you from their mind. And it's unbelievable. It works. But when you're screaming, you know, your pet is missing and you're screaming and yelling and running around, she said, Bernie, that's when it doesn't work. Quiet down and you'll get into your pet's mind and you can talk to them and they'll come. And the cats we have now, taking my wife's place, they really are trying to be affectionate with me. Both if I take a nap or go to bed at night, joining me to give me love. And one morning, it blew my mind because one of the cats, she thinks I will eat a chipmunk. So I get out of bed and I'm heading for the kitchen and she's walking next to me. I thought, what the hell are you talking about? I get to the kitchen, there's a chipmunk lying there. And I know she's telling me, I got breakfast for you. You don't have to prepare anything. I already brought it to the kitchen for you. It breaks my heart, you know, because I keep trying to tell her, I don't eat chipmunks. Don't. So it's been much better lately. But that morning was such a classic that it was so strange, her behavior, walking with me and talking, you know, 100 miles an hour. I got this wonderful treat for you. Because she used to do that when I'd let her out of the house to be free in the woods. Mm-hmm. She would leave a creature at the kitchen door, like, thank you for letting me out. Here's your present. You know, and then she'd spend the day running around. And but she's such an intelligent cat. Her name is Hope. That I could say to her, it's time to come in at night, you know, in my head, and open the door, and there she'd be sitting to come in. I mean, I could do those things with her. So they learn trust.
Yeah. Well, your latest book is called When You Realize How Perfect the World Is.
Well, that's from with my grandson, our poetry. And this is my latest book that came out shortly after that one, No Endings, Only Beginning. The doctor's notes on living, loving, and learning who you are. And this, I'm reading this every night because, I love to read this and my other book, 365 Prescriptions for the Soul, because I find that what I've written, you need to keep rereading it to keep it fresh in your mind. Right. You know, all the lessons you've learned. So this has a lot of, you know, short, like 2 or 3 pages that you can read. You know, it's in a certain chapter, but they're little sections. And I love it. I mean, it's funny. I know I've written the book that say I love it, but it's like after I write it and then I read it is when I can judge it, because I'm reading it as if somebody else wrote it. And I love it. But these two, my grandson, well, let me say why the other book got written. Hold on a second. Because when I was writing No Endings, Only Beginnings, I started talking to my grandson, Charlie. And he is so spiritual. I sent him my poems that he didn't know about, that I wrote when I was in pain as a surgeon, and keeping a journal and writing poetry to deal with my pain. And he's incredible at his age, 30, writing all this meaningful poetry that I didn't do till I'm 60, you know, when I'm feeling it all. So this is Begin Your Quest for Truth. It's the first page of my book, and it evolved because of our conversations. Where is God in all of this? You ask yourself, head in your hands, water washing over your body. Let me turn on the light. From a shower or the rain or your tears. Where is God in all of this? The question echoes across the whole of the gymnasium as your peers laugh and the fear sets in. Where is God in all of this? It is a question we all ask at some point in our lives. Turn the question inward and let it reverberate through your heart, your mind, and your soul. Every fiber of your being. Where is God in all of this? He is in your heart and your breath. He is in every action you take and in every life you touch. Will you accept his presence here? Will you act as an agent of miracles today? Where is God in all of this? God is with me and I am with God. Repeat it, feel it, live it.
That's beautiful.
And at his age, I always say to him, I don't know how you came to share all this. You know, he's like a spiritual old man at age 30. And that's why when you realize how perfect everything is just filled with all our poetry. Because when I realized what he had done, I sent my poems to him. And so, you know, page after page, there'll be on one page my poem, on the other page his. And it was interesting how many times we have written poems with the same title, because we're both seeing the world in that, you know, way. Yeah. I mean, if you want me to come back on another show, I'll read some of them to you.
I think we could do some many shows on you, Bernie.
Yeah. But it's just, as I said, this happened because I was going to write this.
Right.
And was seeking, you know, help and sharing with him, because I wanted to call it like Bible 2, if you know what I mean, that a guide for people's lives. And so I really see this as a guide. There are no endings, only beginnings. Life keeps changing.
And what is the book about then?
Well, it's about life. All these, the no endings, only beginnings. It's about life. Let me just look at, you know, it's the topics. Begin your quest for truth. Live authentically. Be an agent of change. Seek the creator everywhere. Just love. Explore the mysteries. Share your stories. Understand that endings are always beginnings. See? The last thing is hold on. If I have the last story, let me tell you this one. Because the last group of stories is hold on, because it relates to my wife. She would make lunch for me. And in the lunch pail, which is a red pail with the word love in white written all over it, I would open it and there'd be a love note from her with hugs and kisses and little drawings and things. One day I had a horrible day. I mean, in the sense, it wasn't me. It was what was happening to people, emergencies. It was just everybody was having something wrong, and I was in the emergency room like all day long. I was exhausted. About 3:00, I finally had 5 minutes. I said, I got to eat my lunch. So I opened the lunch pail, and there's a note, hold on. I thought, wow, no hugs and kisses, no drawings, just hold on. How the hell did she know what it was going to be like today? So I grabbed the sandwich and I eat it. And I get home that night and I said, honey, you made a big difference in my day. I want to thank you. She said, what do you mean? I don't know how you knew what was happening, but your note, hold on, it got me through the day because it was horrible. She said, Bernie, it was a sandwich with a lot of vegetables. I just wanted you to hold on. I busted out laughing. But those words became a symbol for me, you know, hold on. So that's why I finished the book with, if you read the book, you'll be able to hold on to what life gives you.
Oh, that's beautiful, Bernie.
No coincidences.
Yeah.
That on that day, I got that sandwich. My wife had a wonderful sense of humor. Yeah. One bit of advice for all the women. When your husband is upset and angry and yelling, just say, you're so handsome when you're angry. My wife used to do stand-up one-liners on the stage with me. To show people the benefits of humor and laughter and how much better they felt when they've laughed a few minutes. So we were always working together, and she always had a fantastic sense of humor. But I never forgot that. You know, you'd be upset about something, yelling, something going wrong in the house, and she'd say, you're so handsome when you're angry. And, you know, then the anger's gone and you deal with whatever it is. Yeah.
Oh, gosh. Well, this has been wonderful, Bernie. I know you're a painter now. You're doing a lot of portraits, and I have to paint a portrait of you with a song. So
Yeah, I painted portraits of my wife and I, the children and the grandchildren. It was something I had to do. I couldn't stop. But I also learned that painting makes you lose track of time. It heals your body. I never had pain when I was painting, no matter how bad an injury I had or whatever. I never had pain. And I mean, this is something with my back where I couldn't stand up. It hurt so much, but I could stand if I was painting for hours or at the operating room table. That impressed me. And I always say to people, if you lose track of time, you can't get older. So do what makes you lose track of time. And one last thing that one of our kids did, you write the word words, and they become swords. So you can kill a cure with words or swords.
Okay. Well, I'm going to stew on this, Bernie, and I'll try and write a song for him. I'll try and stew this down into a 3-minute, but wish me luck.
All right.
Well, I hope you have a wonderful day, and I'll send
You're a good listener. Thank you.
Thanks, Bernie.
Glad we connected.
It's been a pleasure.
All right.
Take care.
Well, it's what's within you is what you hear. I've learned that. People come up after a talk. I heard you before. It was the same thing. And the next one comes up and say, I loved it. Thank you. And it's the person, we project onto others what's in us. So if you enjoyed me, there's something good in you. All right. Thanks. Okay, bye-bye.
Bye-bye.
I've come to a choice now. Which road do I go? I'll follow the right fork by taking them both. They're the beginning of a circle that you cannot see, but I'll bring you home like a river to the sea. Oh, Bernie, did you hold on tight today? Draw me a picture of the demons in your way. Oh, Bobbie, I'm taking you out tonight. Leave a sandwich on the back porch, tie a bow to the streetlight. The earth will be absorbed one day back into the sun, but Bobbie and Bernie will remain as one. The cold weather's rising and the icy wind waves, washing all before it froze and all the skies and lakes. With her back to the wind and her voice to the clouds, she found that her spirit could soar above the ground. Oh, Bernie, come up and see me sometime. I'm leaving notes for you everywhere, a penny and a dime. Oh, Bobbie, I heard you moving last night. You got to learn to keep it down. I'm getting up early to write. The end will come for everyone, the goldfish and the young. But Bobbie and Bernie are here for everyone. Send me pennies, send me dimes, any side through the lines. You're still mine. You send me many where I go all the time. The end will come for everyone, the happy and the young. But Bobbie and Bernie will remain as one. Don't search for answers, don't ask me why. Just tilt your head back and laugh at the sky.
Thank you to Maurizio Sarnicola and Massimino Vozza for working with me on the music, and Dori Verbo, my researcher. And thank you to you for listening. Please rate and review the podcast if you enjoyed it. If you like the song and want to support us, then you can download it for $1 on our website at podsongs.com. It's also available on all the major music streaming services. Thanks again.